And today I'm giving you the top signs of high blood pressure, how to identify them, and what to do next. Let's jump into these top warning signs that your body is screaming for you to check your blood pressure. Number one, frequent or severe headaches. These headaches can present with extreme pain. You might have a throbbing at the back of your head, around your neck, even in your eyes. It can be extreme or it can be mild. It can be dull. But if you're having a headache that is unexplained, it definitely could be a symptom of high blood pressure. So what do you do next? Well, one, you consult your doctor, and you also want to monitor your blood pressure at home. Keep a daily log of both your blood pressure and your heart rate. You also want to very carefully identify your symptoms. Is it a throbbing headache? Do I have any weakness with it? Do I have nausea with it? And you want to share this information with your doctor or your healthcare provider. Be sure to watch my video on headaches explained after you finish watching this video. Number two, shortness of breath or problems breathing. How do you identify this warning symptom? Because you're huffing and puffing and you're short of breath. Things that used to give you no problems, minimal exertion, will now cause you to be short of breath. You used to be able to go up a flight of stairs with no issues. Now you're huffing and puffing. You used to be able to walk a mile with no problems. Now you need to sit down and catch your breath after just one block. Little activities like getting up, walking to the restroom, you sit up here and you don't feel like doing it because you know you're going to be out of breath. This is shortness of breath, and it could be a warning symptom of high blood pressure. So what do you do next? Number one, you always want to contact your doctor or your healthcare provider. You also want to make sure you give a detailed history, because having this shortness of breath could mean that the high blood pressure is causing a strain on your heart or your lungs. And it's even more serious if the shortness of breath occurs suddenly and severely without any obvious cause. Oh, and here's a little known fact. High blood pressure is a leading cause of congestive heart failure, which is known to cause a backup of fluid in the lungs and give you shortness of breath. Number three, blurry vision or double vision. You identify this warning symptom because you can't half see. All of a sudden things are looking double or shaky or blurry, and this can happen over time. It can be intermittent, on and off, or it can happen suddenly. Why? Because high blood pressure can alter the vessels in your eyes, and it can cause something called hypertensive retinopathy. And this is when you get damage to blood vessels in the back of your eye and your retina, and it can lead to blindness if you're not careful. So what do you do about it? You definitely want to talk to your eye doctor, okay? You want to contact your ophthalmologist as well as your primary care doctor to make sure your blood pressure is under control. When you go to your eye doctor, they will give you an exam where they look at your eyes, they look at your retina, and they can tell you if high blood pressure is the cause. And even more importantly, they can tell you what to do about it. And we know that the main thing you want to do about it is manage your blood pressure. Question: how often do you check your blood pressure at home? Please put it in the comments down below. Number four, frequent or unexplained nosebleeds. Did you know about this one? Did you know that nosebleeds could be a warning symptom of high blood pressure? Well, they can. And when patients have come to my office with nosebleeds, it completely freaks them out. It just seems like the blood is so red and like there's so much of it. Now, nosebleeds are pretty common, and they can be caused by many things. Trauma to the nose, of course, or even if you have a very low platelet count, or if you have some type of a blood malignancy like a leukemia. So if you identify that you have nosebleeds, what to do next? Contact your doctor, find out what your blood pressure is, and make sure that your CBC, complete blood cell count, is checked so that you know what your white blood cells are, your red blood cells are, your platelets. And then if the problem is your blood pressure, of course, you want to monitor it. Oh, and you definitely want to make sure you stop the nosebleed. So while you're in the process of contacting your doctor, make sure you nod your head forward and you pinch your nose just below the bridge. You want to hold it for at least 5 minutes, and that should slow the bleeding down. If the bleeding continues and you can't stop it, you definitely want to activate the emergency medical system. But first, try to pinch that nose just under the bridge and see if you can nod your head forward and stop it on your own. Number five, chest pain or discomfort. Now, this is a warning sign that you do not want to play with. How do you recognize it? Because you're having severe pain in your chest. It could be in the center. It could be left of center. It could be in your jaw, your neck, radiating to your left arm, both arms. You know if you're having chest pain. And if you are, you want to take it seriously, because this can be a big warning symptom of high blood pressure. What to do next? Don't play around. Chest pain is an emergency, so you want to activate the emergency medical system. Call 911. Meanwhile, you want to make sure you have a system in place to monitor your blood pressure at home once you get back. By the time blood pressure is high enough to cause chest pain, well, certainly that means it could be causing you to have heart disease. We know that high blood pressure is a leading cause of heart disease. It can also be causing something really catastrophic, like an aortic dissection or something of that nature. So make sure that you take chest pain seriously. Question: once you finish watching this video, I want you to tell me what questions you still have about high blood pressure that I didn't answer during the video. Put them in the comments down below. Number six, irregular heartbeat. Yes, if you have palpitations, or if you feel like your heart is beating in your neck or your heart is skipping a beat, that could be a warning symptom of high blood pressure. High blood pressure can put you at risk for atrial fibrillation, atrial flutter, premature ventricular contractions, premature atrial contractions. Bottom line, that's how you identify it. You feel these rapid fluttering heartbeats. What to do next? You already know. Contact your doctor or even your cardiologist, your heart doctor. Find out what your blood pressure is and if your blood pressure is the cause of the irregular heart rate. And then, of course, you want to ask them to do a heart tracing or an EKG to determine what your irregular heartbeat is and, of course, the treatment. I cannot stress enough how important it is to check your blood pressure at home. After you finish watching this video, be sure to check out my video on how to monitor your blood pressure at home properly. Number 7, dizziness or lightheadedness. How do you identify this warning symptom? Well, you feel faint or like you're about to pass out, or you just feel like your head is kind of spinning or a little bit woozy. What to do next? Check that blood pressure. And if your blood pressure is high, or even low, because low blood pressure can cause dizziness as well, make sure you consult with your physician and you come up with an action plan. You also want to get a full workup from your doctor to be sure you don't have something else going on that could be causing dizziness or lightheadedness, like high blood sugar or low blood sugar or anemia or thyroid issues. Number 8, swollen ankles, swollen feet, or swollen legs. Now, this is a big one. Let me tell you, this is how I know that a lot of my patients are vain. They might ignore all these other symptoms that I mentioned, but if they start having swollen feet and they don't look cute in their sandals anymore, or for my men folks, if the socks are starting to leave indentations, that is a symptom that will bring them into my office. I don't have to beg. And here's the issue. That's how you recognize it. If you look and your feet are puffy or your shoes are tight, or if you take your fingers and you press down on your feet or you press down on your legs and they leave an indentation, that's called pitting edema. And yes, it could be a warning symptom of high blood pressure. Here's what's going on. When you have hypertension, sometimes you also have a problem regulating your salt content. And so you may be holding on to salt in your vessels, which causes you to hold on to water in your vessels and in your tissues. And this leads to a swelling. The other very important big deal is that when you see swelling, it could be an indication that high blood pressure is starting to cause kidney failure. And we know that high blood pressure is the number 2 cause of kidney failure in this country. It's the second most common reason that people end up in my dialysis unit. So if you notice swelling, don't just ignore it. Don't just poo-poo it off to the side or come up with excuses. Make sure you consult with your physician, monitor your blood pressure, watch the salt in your diet, and get that blood pressure under control. Question: which of the warning symptoms of high blood pressure surprised you? Also, please give me some more ideas of some warning symptoms that I did not mention. Put them in the comments down below.